Assalamu alaikum wa rahmatullahi wa barakatuh. Good day, everyone. On behalf of the Saudi Patient Safety Center, I would like to welcome you all in our webinar for today. My name is Faisal Al-Ataibi. I'm Patient Safety Specialist at the Saudi Patient Safety Center. I will be serving as a moderator for this session. It's my honor to introduce our speaker, Ms. Zainab Al-Basha, who will be speaking to us on the impact of health insurance on the patient safety journey. Ms. Zainab Al-Basha is currently the Director of Enablement in the Council of Health Insurance. She has a bachelor degree in nursing and master of business administration. Ms. Al-Basha is certified and licensed professional from different international institutions, and she's a member in various national and international committees and society. Ms. Zainab, over the years, has led multiple projects on the institutional and regional and national level to ensure the compliance to high quality standard. Before we start, just note for any question, please write them down in the QA section. So Ms. Zainab will answer them at the end of this presentation. Now, please join me and welcome Ms. Zainab to take us through this very interesting topic. Ms. Zainab, the mic is yours.
Thank you, Faisal. The pleasure is mine to be with you. Good evening, everyone. I'm happy to be part of this highly impactful session. I'm looking forward to meet you all in more future sessions, inshallah. Assalamu alaikum jami'an, ya'tikum al-afiyah. So can you start now, Faisal, or shall we wait for a couple of minutes?
No, you can go.
Okay.
Yes.
So starting today, our session, the impact of health insurance on patient safety journey and the interest of the Saudi Safety Patient Safety Center, or their main focus in safety journey, and our main focus as Council of Health Insurance and the health insurance part and the beneficiaries and how they are getting all their rights in a safe environment with high expectations and high quality. This collaboration will end up today presenting our health insurance regulations or the new standards and the health insurance that we developed in the Council of Health Insurance in KSA in order to improve the beneficiary journey within the healthcare providers and in the interaction with the health insurance companies, and in order to enhance the market of the health insurance in the kingdom and improve their performance. So starting our session today, why we are here, I believe we are here to discuss the impact of the health insurance on the patient safety and how it's impacting, or what's the regulations that we set in KSA in order to make sure that the health insurance is highly beneficial and safe for our community and citizens and all the visitors in the kingdom. One of the objectives today is to introduce our KSA standards for the health insurance that we developed in the Council of Health Insurance for the health insurance companies and healthcare providers working in the health insurance market. To enjoy our coffee as well, so please be sure that your coffee is ready during the session, and to answer all your questions and queries as well. So let's start our journey today. Let's ask a question and let's check the knowledge of our participant. Do you have any idea what's the health insurance? And please share your thoughts and your own definition within the chat so we can go through it. We'll give you 1 minute so we can look at your answers. What do you think is the health insurance, or the definition of the health insurance? Please write your answer in the chat so we can read your answers. What do you think is the health insurance? Or what's your definition or understanding about the health insurance? Great, so I'm seeing a lot of answers. After 1 minute, you can go through them.
You'd like to go through them? Or you can hear?
Please go ahead, Faisal.
Yeah. Some people define the health insurance as a third-party payer, and somebody is define them as a insurance taking out to cover the cost, covering the cost of medical care. Some people define it as a seek medical help with a low cost, cover the whole or part of the risk of the patient, acquiring medical expenses, medical services. Client pay some fees annual to cover healthcare services. All these are participation from our attendees. Company to pay all the medical care expenses, payment to cover all the healthcare issue for individual, the payment for the provided care. All it's about like one topic or one area.
Great, thank you, Faisal. So let me take you through the definition of the health insurance. Actually, most of the answers was right that you mentioned. So the insurance is covering or providing the payment to cover a certain benefit, a defined benefit for a certain defined beneficiary to cover their sickness or injuries and pay for it, or covering the risk related to it. So this is, in summary, the health insurance. The health insurance, in practice, it's a relationship in between four parties. The first one is the employer who buy the health policy for their employee, who became then, after holding the policy, the beneficiary of that policy. Then this relationship will be taken out to the health insurance company and healthcare provider who will be interacting with each other throughout the year or throughout the lifespan of the health policy, in order to make sure they serve at the end the beneficiary according to the defined policy or according to the defined health policy, making sure they are taking all their rights and they are receiving the highest quality of care. This is an summary of health insurance. And moving toward our role in KSA as Council of Health Insurance, we are a beneficiary-centric, and we believe that everything seems to be good until you start targeting the great. So as a beneficiary-centric, we started in designing our strategic plan in 2019. And from beneficiary-centric perspective, we designed the strategy according to our main group, who is our beneficiaries. We designed the initiatives, the goals, and all the projects that we make sure at the end of the day, it will help the beneficiaries to get their rights, and it will help the market to grow up in a healthy way, interacting within well-defined and highly developed standards of insurance. From this perspective, or from this point, we started in CHI designing one of our main initiatives, which is the developing the standards of qualifying health insurance companies and accrediting healthcare providers. Our improved standard of accreditation and qualification the journey started in 2019, where we started doing our gap analysis, we benchmarked with almost all the available international programs in accreditation for health insurance. We benchmark with the NCQA, the National Committee, the National Quality Committee, American Quality Committee and Association for healthcare plans and home healthcare. We benchmarked with the different countries, and we can say at the end of the day, after having this program in Saudi Arabia, it's one of a kind that we believe we couldn't find any similar program in the Middle East, and we couldn't find any similar program or well-structured program in the way it's structured in the international wide. The program started as a development or as a baby step in 2019 with the benchmark, baseline assessment, and gap analysis. We tried in the kingdom to make sure that all stakeholders are aligned with us in order to implement and develop this program. We take all the opinion from the market. We did a lot of pilots for different level of organizations where we go small, medium, and big and corporates. We did a pilot of the program on these kind of organizations. And we did pilot as well for the health insurance companies, starting from small and medium and big insurance companies, to make sure that all the standards are implementable and achievable and understood by the end user, which is the final part, the one working in the insurance company and the approval desk, or the one working in the healthcare provider and the revenue cycle management office. After that, we get it approved by the board of our council to be kicked off, and we started this year implementing the standards in the kingdom. The main aim of the standards, if we can classify them, they have a structure, process, and outcome standards. The structure standards, or in the structure standards, you are assuring that healthcare providers and health insurance companies complying with all governmental and regulation requirements. And when we talk about governmental and regulations requirement, we talk about the licensing. So any health insurance companies or should be licensed by the Saudi Central Bank. Any healthcare provider in the kingdom should be licensed by the Ministry of Health. And there is additional requirements when it comes to laws and regulations through different governmental authorities that we need to make sure it's available, valid, and according to the expectations. The healthcare provider in particular, they should hold an active license and accreditation, like national or international programs for accreditation, to make sure that they are at least the minimum requirement of healthcare quality, or the quality of the medical care, which is focusing on the patient safety. At the end of the day, we can tell by having or holding an active accreditation certificate from national or international body that you are safe environment for our beneficiaries who are holding the insurance policies. Some license like ICD-10 for coding the service to make sure that all the service received by the insured patients are coded in a right way. And at the end of the day, we can have a data that help us to promote the health more according to these codes. Another thing that we are acquiring from both parties to hire qualified and licensed medical and non-medical employees. So in addition to the certification from accreditation body, again, we are asking that you have enough qualified and certified licensed medical staff to make sure that our patients handling the health insurance, they are in a safe environment, treated by a licensed clinicians or nurses or any medical staff, and qualified and licensed non-medical staff to make sure that they are, at the end of the day, meeting the expectation from their job, making sure that the insurance cycle within the organization are moving smoothly and seamlessly, and the insured patients are receiving all their care in a safe environment. Adopting high technology. So part of our standards and laws and regulations as well is to adopt high technology in a way of having the HIS system within the organization. If you don't have an HIS system, we make sure at least that you are able to integrate with the, as a provider, to integrate with the health insurance company and vice versa. And both of you can serve the insured patient to make sure that you can check all the requirements before providing any kind of care. that you are checking all the kind of information before providing any kind of care, and it's all tagged within your health insurance or your HIS system, if it's within HIS system. If it's not within the HIS system, at least the way of communication that you are using, or the media of communication that you are using between you and the healthcare provider and insurance company, as a healthcare provider and insurance company, assuring the exchange of information is in a safe and confidential manner. As a structure as well, we have a policy, so all the beneficiary who are receiving a health policy or insurance policy, they need to declare all the information, or the medical in particular information, to make sure that when they go to be treated in any organization, all their information are available for the providers. It helps the payers at the other side to price the policy as well, but again, to make sure that all information are declared from the beginning, so the hospital, they know they are dealing with what kind or what type of patients. Also, we are assuring that the healthcare providers and health insurance companies complying with the policy and processes of identifying the insured patient and their eligibility. The first international patient safety goal is to identify your patient right. So again, in our laws and regulations and standards, one of the requirements is to identify the insured patient right, using different methodologies to identify, or tool identifiers to identify the identity of the insured patient and their eligibility and their health policy, the requirements, the coverage of the health policy, the benefits of the health policy as well. So as insurance company and healthcare provider, they need to comply with all policies and processes in identifying the insured patients and their eligibility. Second, the policies and processes for requesting pre-authorization and medical approval. For any insured patient, when they visit any healthcare provider, if they are an emergency case, this is a kingdom law that any life-threatening cases, they don't require to seek any kind of approval before delivering the care. So any life-threatening cases, according to our law, they can be treated within any healthcare provider without seeking or granting a pre-approval for the care till they are get stabilized, and within 24 hours, the health insurance company can be notified about the patient and their health condition. So in order to assure the safety of our patients during life-threatening condition, and not to get busy with seeking approvals and waiting for acceptance or waiting for feedback from the insurance company, we have set a rule that any life-threatening condition need to be treated, and the approval is granted regardless of the case. They need to send within 24 hours a confirmation, or to inform the health insurance company within 24 hours that this case has been received and the patient is stable now. For any non-emergency cases, there is a pre-authorization and a medical approval for any service will be given to the insured patient. For this has two purposes. First of all, to make sure that all the services going to be given to that insured patient is within the health policy he is assigned to, and to make sure there is no duplication and no missing, nothing missing from the requirements of care or the requirements of the treatment. So the healthcare provider, they send a pre-approval or pre-authorization to make sure to the insurance company to grant their approval in order to deliver the care to the beneficiary. This helps in two things. First of all, to make sure there is no redundancy in the labs and X-rays required, and there is no repetitive, unnecessary repetitive exams, and to make sure that this requirement are covered within the health insurance plan of this particular insured. The medical approval and the discussion of, there is a time window in between the health insurance company according to our laws and regulation for the health insurance company and healthcare provider to discuss the case and to make sure that there is no previous similarities in delivering this care. So it's not a repetitive care. If it's a procedure and they need to do it twice, they ask for more information. They make sure that the care delivered to the patient intended to solve a certain problem. It's not repeated, not extra service, within efficient way. We make sure as well that both parties are complying with the evidence-based guidelines, pathways and protocols, population health and value-based healthcare. So we make sure that both parties are following the up-to-date evidence-based practices, guidelines, pathways and protocols in treating the patient. And they are designing a new, or they started at least designing the population health and value-based healthcare program according to our Vision 2030. We cited all the KPIs, the requirements. We are supporting all the healthcare providers and health insurance companies with the availability of endorsed guidelines from the Saudi societies to make sure these are covering all the aspects of care, of clinical care, and it is the up-to-date guidelines available in the market. Finally, in the process standards, or the standards that covering the process of the health insurance, the beneficiary bylaw and their rights and active participation in their treatment. So we developed a beneficiary bylaw that covers their rights and responsibilities in the health insurance to make sure, and this bylaw is communicated as well with both parties, health insurance companies, healthcare providers, and with the beneficiaries themselves as well, to make sure that they have their rights at the end of the day, and to make sure that they have active participation in their treatment plan and the decision of their care. We are assuring us through our standards that both parties as well, they are managing their data. So they are looking at their outcome. We close the part of an infrastructure or structure. We cover the part of the process, and finally covering the part of the outcome. So we make sure that they have a certain set of KPIs, indicators that shows or reflect their performance and a data in scientific way and what they are doing about this data. We are setting the target for them, and we make sure that they are meeting these targets, and if they are below the target, what's their corrective action plan. So there is a set of KPIs covering the medical part and the insurance part. Part of it is the satisfaction of the beneficiaries within the healthcare provider and with the interaction of the health insurance companies. Some of the KPIs is related to the medical care, so it reflects the rejection of the medical care, the coverage of the medical care. Some of the KPIs related to responding to the complaints of the beneficiaries within the insurance company and within the healthcare providers. So as a regulator, we set the KPIs, some of the KPIs, and the other KPIs, we are asking the health insurance and the healthcare providers to set their own KPIs, and we measure their performance against all these KPIs with their targets to make sure that they are complying with all the requirements. So looking at the standards in action, our standards after the approval, we started onboarding for the healthcare providers and health insurance companies. So each organization within the kingdom working within health insurance going to go through onboarding cycle or onboarding program where we got introduced to the standards, how they are implemented, what's our expectation out of these standards. Then baseline assessment. So each organization going to have a baseline assessment to know where they stand from the standards, what's the gap to reach a higher percentage. Then they will have a chance for a consultation. So it's a time where we can discuss how we can support each organization, what's their inquiries, what's their challenges, how we can work on it and resolve it. Finally, the reporting and scoring. So each organization going to have a reporting and scoring against the final or the scoring matrix that we developed within CHI. They will receive a report, a recommendation, and they will be asked for corrective action plan. So this is an annual process that each organization going to go through it to make sure at the end of the day that our beneficiaries are receiving the care they need according to the set of standards, and they are active participants in their treatment plan and the treatment cycle within the health insurance companies and healthcare providers. It's time for questions. So let's hear from your side. If you have any question, please, you can write it in the chat, Faisal, or the question and answers.
Both are okay, but we prefer to get your question on the Q&A section. Thank you, Ms. Zainab, for this informative presentation. Sweet and simple and very rich, informative. We got a couple of questions while you are presenting. You speak about the standard and the accreditation. It's covered the healthcare insurance company and the healthcare provider. Does the regulation in the CHI cover, for example, the business center within the government hospital as they consider private sector?
The business centers and the governmental hospitals is a different story. So our mandate as Council of Health Insurance is the private health sector. The governmental entities, they have their different or separate regulations that, again, the standards can be applied to them if they are part of the CHI. So if they are registered within CHI, yes, these standards going to be implemented. But again, the business center that treating any patient with insurance, yes, it's implemented to them. There is a fine tweaks to some standards because we have a different regulations for the governmental entities. But yes, again, the standards will be implemented in all.
Okay. Another question is asking, since you are mentioning the KPIs, that you have some KPIs that's mandated for the healthcare providers and health insurance company. He speak about the patient-reported outcome measure. Are you monitoring these kind of KPIs or measures?
Yes, it is within the set of KPIs that we are acquiring from both parties. And there is a clear target, and we are following the international KPIs and the patient outcome measures.
I have a question come to my mind, since you are speaking about the transformation on the national level and the value-based healthcare that we are having now. And you mentioned the KPI, and you speak earlier that you benchmark some experience internationally. I believe in US, they start the health insurance by developing some initiatives and program like pay for performance or value-based purchasing. Are we trying to do the same thing like what they did?
Exactly, in our Saudi custom.
Okay.
Yeah.
Okay.
So we are having the value-based healthcare. It's one of the national initiatives within the Vision 2030 under the health sector. And we are trying, we are in the phase of setting the strategy for the value-based healthcare. It is within our standards as well. And for the implementation, we postponed the implementation of these standards. So we have the full plan and strategy for value-based healthcare available to the market. It will require time as well. That's why we phase our plan of implementing the standards of the health insurance into 5 years. So we make sure that the value-based healthcare is already kicked off get it implemented, then we can start evaluating them against the value-based healthcare standards required.
Okay, to align with all the effort in the healthcare system.
Absolutely, absolutely.
Okay, we get a question from someone who's saying that we don't have a CHI in our country. Ministry of Health is covering all the regulatory operation regarding the private sector. Is it valuable to have a regulatory body to cover or focus on the private sector rather than the Ministry of Health?
It depends. As CHI, our role is to cover the health insurance part, while the Ministry of Health, they remain there to cover their regulatory part for the health. So our mandates are different, totally different. The Ministry of Health is the super regulator in the kingdom, where they license any organization wanted to practice within the health or wanted to practice anything related to the medical care. Any organization licensed by MOH it's not necessarily to be within the insurance market. So to be a healthcare organization within the kingdom, you need the Ministry of Health license. But if you seek to work within the health insurance, then you will need the Council of Health Insurance license, in addition to the health license. So the Ministry of Health, they are a regulator for the health part, health policies within the kingdom. We are regulating the insurance part within the provider.
Okay, another question, I hope I get it right. Somebody is talking about the patient-centered care and promoting by the insurance. Is the insurance promoting the patient-centered care, or we find challenges? If you can provide an example, how the health insurance promoting the patient-centered care?
I couldn't get the question, Faisal.
I think he speak about how can health insurance try to promote patient-centered care based on the need, the value for the patient. How the health insurance, what's the role of health insurance? This is how I get it.
Okay, so population health, primary health care is our new initiative, and we are in the building phase currently. This is the one that focus on the patient-centered care, where the family physician of the family or of the patient, they screen all the patients and families, and they make sure that there is a patient-centered care instead of just referring the patient to whatever specialty they are seeking. And this is started as well by designing the new essential benefit package within the Council of Health Insurance. So we designed a new benefit package that makes sure there is a patient-centered care and there is a population health identified and the enhancement of care. Instead of just treating the disease, you need to enhance the care. So it's built according to this. Is there a challenge? We will, for sure, we will be facing a challenge at the implementation, first implementation phase. But again, it's a change management strategy.
Okay, since you're starting the implementation, I believe in this year, right? Or you postponed the implementation, you just released the standard?
The standards? The standards already released and we started the implementation. By mid of November, we'll be having the first onboarding session for the health insurance companies. And after the end of November, we'll be having the first visit to the health insurance companies. Then the provider will be coming after them as well. So the standards are covering both parties. Maybe the providers, they have a list requirements within our standards because already we have a national accreditation body within the kingdom, the BAHI, who are covering the quality of the medical care. So we don't need to look at a lot of things. We need to look at the insurance cycle only. While in the insurance company, we need to cover a lot of more aspects, like the risk management, the quality, that's not addressed by any accreditor within the kingdom for the insurance companies.
Okay, thank you very much, Ms. Zainab, for answering the question. Dear participant, Saudi Patient Safety Center would like to remind you that the registration for the third Patient Safety Center conference is now open. You can visit the link through the webpage of the center or in the Twitter account for the Saudi Patient Safety Center. And as we reach to the end of this webinar, on behalf of the Saudi Patient Safety Center, we would like to thank Ms. Zainab Al-Basha for this presentation and this information that we get it in this webinar. And thank you for you, our audience, for joining us today. As a part of the Saudi Patient Safety Center effort to provide you with the timely topics and interesting speaker, we would appreciate it if you fill out the evaluation survey, which will be sent to you after the webinar. Thank you for joining us today. We are looking forward to welcome you back in the future webinar. Thank you very much.
Thank you, Faisal, and thanks for all the attendees. Please stay in touch for any queries or any future support. We are available for you. Thanks for Saudi Patient Safety Center for their hospitality. And thanks for all the audience for their questions and interaction. Thank you for you, Faisal, as well, for coordinating this session.
It's my pleasure. Thank you.
Thank you.